Hello toppers. Today the topic of discussion is glycogen storage disorder, and here we will be seeing mainly the mnemonics. So let's get started. So there are around 6 glycogen storage disorders. Type 1 it is von Wieck disease, and type 2 it is POMPE'S. Then type 3 it is coridisease or Forbes disease. Then type 4 it is Anderson. Then type 5 it is McArdle, and type 6 it is herdisease. So we can remember this in sequence with the help of the mnemonic. Very perfect colleague Anderson married her. So very von Wieck disease, Pompey perfect, Corey is for colleague and Anderson directly Anderson. McArdle married, her is directly her. So you can remember the sequence of this glycogen storage disorders with the help of the mnemonic. So before entering in detail with the diseases and their symptoms, let us know the basic metabolism. So we all know glucose is the most abundant monosaccharide in our body, which forms the main source for our energy. So here let's see what is the storage form of glucose. It is glycogen, and here whatever problem is happening in this glucose to glycogen and glycogen to glucose pathway, that will lead to this inborn error of metabolism, that is glycogen storage disease. We should know this very brief so that we can understand each and every disease in a proper way. That would be easy for to remember. So this glycogen is stored in our body in two places, that is liver and muscles. So next thing, what is glycogenolysis? So with the name itself we can say it is glycogen getting lysed. Lysed matlab it is breaking down. So if there is breaking down of glycogen to glucose, that process is called glycogenolysis. So if it is happening in the muscle, the glucose produced would be utilized by the muscle itself, and if the glycogenolysis is happening in the liver, that glucose would be utilized all over the body, mainly CNS, because our brain mainly uses the glucose form. So this you have to remember, the main source of glucose in our body is through liver only. So let's start with the two different terminologies of glycogen metabolism, that is glycogenolysis versus glycogenesis. So genolysis is nothing but glycogen is getting breakdown to glucose, and glycogenesis means glycogen is getting formed. Genesis matlab formation. So let's start with the diagram. So we are not going to discuss regarding the glycolysis, which is the major glucose metabolism in the production of energy. We will be discussing only regarding the storage form. So first glucose is there, and glucose 6 phosphate got formed, then glucose 1 phosphate, and here we can divide the cycle into two, that is glycogenolysis and glycogenesis. So let us discuss regarding the glycogenesis first. Glucose 1 phosphate gets converted into UDP glucose. We are just discussing only the basic mechanism. We are not going in detail. So this is enough to understand the disease conditions. So here UDP got formed, and now from UDP glucose, glycogen had formed with the help of the enzyme glycogen synthase. So in case of glycogenesis, the most important rate limiting enzyme is glycogen synthase. This is very important enzyme, you should know. Then let's start with the glycogenolysis. Here glycogen, in case of breakage of glycogen to the glucose, here it is converted to glucose 1 phosphate with the help of the enzyme glycogen phosphorylase. Here it is the rate limiting enzyme in case of glycogenolysis. So whatever we are studying, we have to remember mainly regarding these two enzymes, because these two forms the rate limiting step. Okay, this glycogen synthase and glycogen phosphorylase. Then this glucose gets converted to glucose 6-phosphate with the help of glucose 6-phosphatase, and this reaction exactly will happen in the reverse direction in case of glycogenolysis. So, adding to the same pathway, we should know regarding the two more enzymes which are more and more important, that is branching enzyme and debranching enzyme. Let me explain how it is working. So, we all know here glycogen is getting formed. So, glycogen will be there and there will be another one glycogen coming and adding to it because it is a storage form. So, glycogen, lot of glycogen will be formed and they will be getting added. So, here what this branching enzyme will do? This branching enzyme will do branching like instead of glycogen getting in a straight line in infinity, that will lead to the damage of the organ. So this enzyme helps in the branch formation, like directly there will be 4 to 5 lines, adding to that there will be glycogen in the second branch. So this helps in the branching formation, and this branched glycogen will not lead to damage of the tissues. So here it is mainly 1,6 alpha linkages will be formed. Okay, and what this debranching enzyme will do, here this glycogen is branched. So whenever it is going back to the glucose formation, here that branched enzyme would get debranched. That is, this glycogen compound would be break down with the help of debranching enzyme, and then it is easily converted into glucose. So this helps in the branching, like 1 plus, it will be going like this in a straight line. So this branching enzyme helps in the formation, not in the formation of infinity, it will cut down it and it will add the another glycogen molecule in the center. Okay, so that is alpha 1,6 phosphatase. Okay, so this is the branching enzyme, and here what will happen, it will break the branch and it will keep every single molecule in a separate manner. That is the work of debranching enzyme. Okay. So let's start with the first disease, that is Van Gryke disease. So here what will happen, there will be lack of glucose 6-phosphate. So what are all the symptoms we can see here? It is hepatomegaly, hypoglycemia, then hyperlipidemia, then hyperuricemia. Let me explain you how it is happening. So we all know very well regarding this simple and brief mechanism of glycogen formation and glycogen breakage. So here there is problem in glucose 6-phosphatase, you know, and that is leading to these type of symptoms. Let me explain. So here, because of the lacking of glucose 6-phosphate, what is happening? Already glucose 6-phosphate is in lacking. Okay. So because of its lacking, there will be no formation of glucose. No glucose will be there. Yes, we all know. So if there is no glucose, what will happen? There will be more glycogen. Glycogen will be more, and that too abnormal glycogen will be there because branching and debranching had been done, and more amount of glycogen will be circulating in the bloodstream. Okay, this glycogen go and deposit in the liver. Okay, they get deposited in the liver like this and they form hepatomegaly. That is the first reason, hepatomegaly. So hepatomegaly formed. So once liver is getting affected, liver is the main source of glucose metabolism. So if there is problem with the glucose metabolism, there will be hypoglycemia. Okay. Then if there is hypoglycemia, there will be lack of energy for the tissues. There will be lack of energy for the tissues. What will then, our body will be demanding for more energy. That time our body will be shifting the mechanism towards the stored form fat and proteins. So there will be breakdown of fat and protein to get energy. So if there is more breakdown of fat and protein, what it will lead to? It will lead to hyperlipidemia. in case of fatty acid metabolism, and in case of protein breakdown, what it will result? It will result in hyperuricemia. Okay. So this is the reason, and this is how the symptoms are formed in case of von Wieck disease. So hepatomegaly is mainly because of abnormal glycogen getting deposited in the liver, and if liver forms the main source of glucose metabolism, if there is any problem with the glucose metabolism, that will lead to hypoglycemia, and if there is hypoglycemia, there will be lack of energy in the body. So our body will be switching our energy metabolism towards fat and protein, which got already stored in our body. Then if there is lot of breakdown of fat and protein, that will lead to hyperlipidemia and hyperuricemia, and this is the main causation. So try to remember that von Wieck disease, there will be deficiency of G6 phosphatase enzyme. Okay. So next disease, it is coridisease or Forbes disease. It is exactly similar to von Wieck's disease, but adding to that, the main problem is there will be lacking of debranching enzyme. So symptoms will be very similar. Adding to that, there will be debranched glycogen structures. Let me explain you how it is happening. So we know in this pathway the problem is with the debranching enzyme. So the same things are happening. So let me tell you how it is there. So because of the lack of debranching enzyme, so glycogen will be in a branched state. So this enzyme is very much needed to break this glycogen into different parts, and then only it will be converted into glucose. So this glycogen will be in a branched state. So this branched glycogen gets deposited in the liver. Okay. So that is the extra symptom which we can see other than von Wieck disease, because that is in von Wieck disease also we had seen there is a problem with this mechanism only. Here the problem is starting little bit earlier, but there will be abnormal debranched glycogen deposition in the liver that we can see in specific to the Cories or Forbes disease. Then comes Pompey's disease. It is little bit different disease, but let's see how it is different. So here also there will be lack of debranching enzyme as we had seen in the Cories disease, but it is very much specific to the lysosome. Apart from the normal production of debranching enzyme in our body, lysosome also produce some debranching enzyme. So because of this only Pompey's disease occurs, and it will lead to cardiomegaly. Let me tell you. So here we all know debranching enzyme how it is working, as we had seen in the Cories disease. But here this Pompey's disease is very specific for the lysosomes. If the lysosomes which are present in our body, they are not having debranching enzyme, that will lead to Pompey's disease. So what will happen here? Already we had seen in case of Cories disease, this abnormal glycogen gets deposited in the liver. But in case of Pompe, it gets deposited in the heart, which is mainly nothing but cardiac muscles. So this glycogen gets deposited in the cardiac muscle, which leads to bigger size of the heart, that is cardiomegaly. Okay. So this is the exact mechanism for this Pompey's disease. Next, there are two disease conditions which are very similar, that is McArdle's and herdisease. So here there will be lack of glycogen phosphorylase, and in case of McArdle, the glycogen phosphorylase mainly comes from muscle, and in case of herdisease, the glycogen phosphorylase mainly comes from the liver. You can remember as MM and HH so that it would be easy for you. If there is lack of glycogen phosphorylase in muscle, that will lead to McArdle's disease, and if there is lack of glycogen phosphorylase in liver, that will lead to Her's disease. Let us see. So This is the exact thing, glycogen phosphorylase. So let's see the different symptoms present in both the diseases. In case of McArdle, we know the glucose or glycogen which are stored or break down from the muscle are mainly utilized by the muscle only. So here, because of the lack of glucose or because of the excess amount of glycogen, there will be muscle cramps on exertion. Okay. Then hypoglycemia also we can see on exertion, and just because the muscles are getting cramped and lot of energy had been put on the muscle, that will lead to the muscle injury, and that causes myoglobinuria. Okay. So simple, McArdle's disease, we can see those mainly in the muscle. So whenever the glucose is produced in the muscle, that is utilized by the muscle only. We had seen that already. So here whenever there is lack of glucose in the muscle, that will lead to the muscle cramp on exertion, because on exertion we need more energy. So there won't be availability of more energy because of lack of glucose. So that is the exact symptom. Adding to that, myoglobinuria will be seen just because of the injury happening in the muscles. Then comes herdisease. Here what is happening? Here we can see hepatomegaly. Yeah, this very often we can see in all the glycogen storage disease because of the deposition or accumulation of the glycogen. Various form of glycogen, maybe it is branched or debranched or different type. And here we can see fasting hypoglycemia. Here you can correlate because liver forms the main source of glucose in our glucose metabolism in our body. So once liver is getting affected, then we can see severe hypoglycemia like fasting hypoglycemia. Similar way, in McArdle's disease we had seen hypoglycemia on exertion only, because muscle does not contribute much for our body, but liver contributes much for our body in glucose metabolism. That's why it is leading to fasting hypoglycemia. Then at last is Anderson disease. Here there is problem with the branching enzyme. So that will lead to cirrhosis. Let me tell you how it is happening. So the problem is with the branching enzyme. So because of the absence of branching enzyme, what will happen? Already I had told you this glycogen will be coming and adding, and it will go to infinity if there is no branching enzyme. So this branching enzyme helps in forming the branches and helps in the storage of glycogen. Okay. So if branching enzyme is not there, this abnormal glycogen gets deposited in the liver, which proves fatal for the liver. Like because of its deposition, the liver will undergo a severe damage, and that will lead to the fibrosis and severe form of cirrhosis, which may result in fatality. Okay. So that is the thing regarding the Anderson disease. So I think now it would be easy for us to remember this glycogen storage disease. Just we should know regarding the glucose and glycogen metabolism, so that things will be easy to remember in a better way. So happy learning. Thank you so much.